Once again, a very good afternoon to all of you. Most of the topic about microwave is covered by my senior, pointing to the few aspects which are important in view of operational and industrial hazards seen. Microwaves in industries and industrial region mainly seen in radar systems and medical equipments and treatments. The other most common, but also not in industrial level, but in a higher hotel management level, is seen in microwave ovens. Though even after many guidelines are taken at every stage, in the manufacturing stage, in the organizational level, and in the ground level, even with this much care taken, many cases are being reported with hazards. Usually, I think it can be taken, it is all just because of the carelessness in handling and less awareness amongst the workers while they are handling such highly energy devices. As already discussed, the effects usually will be the thermal effects and photochemical effects, and cornea and lens are the most commonly injured part of the eye. And the extent of injury depends on the intensity and the severity of the energy. The mechanism of injury goes like this. Because of the microwave radiation, there is heat generation which causes thermal damage to the ocular surfaces. And because of this raised temperature, there is chemical injury, that is denaturation of proteins. Finally, in the lens, it leads to cataract formation because of protein denaturation and decompensation. And also the corneal decompensation occurs, and also with epithelial burns, and patient presents as photokeratitis. When the energy is very high, but in rare conditions also can damage retina and the optic nerve because of the very high radiation. Patients usually present with photophobia, redness, and watering. When the posterior power segment of the eye is affected, and patient can also present with blurring of vision, metamorphopsia, and scotomas. Starting with the evaluation, detailed history is very important, and the exposure time and exposure duration is very important in this kinds of injuries at the industrial level. After this detailed slit lamp examination and posterior segment evaluation by fundoscopy, few investigations will aid us, like fluorescent staining helps us to see the extent of corneal burns, and this is the picture showing superficial corneal burn and the fluorescent stain taken up by the damaged epithelial region. And in the slit lamp examination, this is a picture showing the sudden onset of cataract formed after a brief exposure of this high energy in an industry. The equipped investigations like OCT and electroretinography helps us to see the functional and anatomical status of damage to the retina. I want to mention few cases at industrial level and also at domestic level caused by injury due to microwave radiations. This was a case where a 39-year-old engineer, while his work in the radar platform, he got exposed to microwave energy because of his negligence and not using the protective wear, where in the first day there was no much of the findings encountered when he visited the ophthalmologist with complaints of irritation and mild blurriness of his vision. But over a period of a week, he developed anterior and posterior subcapsular cataract, and over a period of 15 days, it progressed to such an extent that this young engineer had to undergo a phacoemulsification surgery and intraocular lens implantation for this negligence. And subsequently, he was under follow-up, and also patient developed severe macular edema, and this was suspected that because of the high energy which he was exposed, that posterior chamber was also affected, but it presented a bit in a later condition. But thankfully, patient was recovered well with topical steroids and also initial dose of oral steroids for his macular edema. One more case which was encountered in a five-star hotel was a worker when he was working with a big microwave machine, and just because of his negligence and he didn't operate the machine properly, when he opened the microwave door which had a very superheated liquid in the dish, he sustained injury to his ocular surface, leading to stem cell injury also. Patient presented with periorbital edema, severe chemosis, and severe injury to his corneal epithelium. Initially, he was treated with lubricants and topical antibiotics, but at later, patient ended with severe limbal cell injury, which he had to undergo limbal cells transplantation for the same. Though it is out of this subtopic of industrial and industrial level, I want to quote two cases which had happened at the domestic level, that old age person, he was using water and he mixed Vicks Vaporub normally used in the domestic purpose, and he heated it in the microwave. Accidentally, without proper precautions, he opened it and there was splash of that fluid into his eye, which caused injury to his ocular surface. Patient had to undergo amniotic cell transplantation, and also with that blunt trauma with this heated fluid. At a later stage, patient also ended up with phacomorphic glaucoma and also bullous keratopathy. A child, because of mishandling of the microwave at the home, sustained injury to his ocular surface. Patient was managed with topical steroids, and he also ended up having pterygium, a permanent corneal scar, and a symblepharon formation. Starting with going generalized with the treatment, as sir already mentioned, it is pain management with analgesics, copious use of lubricants, and low-dose steroids at some extent also needed. For corneal burns, it will be low-dose steroids and antibiotic cover-up. When cataract is to such extent, patients might also need cataract extraction. And for retinal damage, it will be topical steroids, and if there is any disruption, surgical intervention also necessitated. Starting with the precautions, the protective eyewear in industries, it should be a proper eyewear, proper distancing from the high energy devices, and proper shielding is needed. Proper regulations should be followed in every industries to prevent such mishappenings just because of lack of awareness. Proper handling and servicing of the industrial equipments are needed. Thank you.
Thank you very much for nice presentation. And